So hello to all my dear aspirants, welcome to Sail to MDS Dental Academy, myself Dr. Malay Trivedi. So to decrease, or I want to say to wash out the confusion of the children, I am providing a blueprint that how you have to go in 90 days, because many students are asking me, sir, hoga ki nahi hoga 90 days mein? Yes, hoga. You have to believe hoga. You have to be calm. It is a tricky period. We can do it 90 days or not, but you have to come and you have to focus on yourself and always have a good positive mindset. Yeah, I am going to do it. Okay, I always say in my many of the lecture about blue sky thinking. So always aim high. It will done or not, leave on the God and focus on your preparation. So now 90 days are left. How you have to do? We'll see in very simple manner in three things. First, we'll divide the days, we'll divide the time, and we'll divide the subject. So on that you can plan it of yourself. And I tell you, I always request you to all, please have blueprint. Okay, ऐसे ही मत जाओ, हाँ आज पढ़ा, कल नहीं पढ़ा, ये पढ़ा, वो पढ़ा. Have proper blueprint. You know, we doctors always consider prognosis while diagnosing and treating the patient. So in same way, regarding preparation also, you have to have the prognosis, you have to have the blueprint in your mind. So friends, let's get started and focus on it. So first, we'll divide the subjects. The way of subject division is very simple. I will divide subject in 4 parts. That is the long clinical subject, short clinical subject, pure basic subject, and interrelated subject. In GPSC, one more thing is that is the journal study also. Fine. So what are long clinical subject? It's oral path, oral medicine, perio, ortho, pedo, prosto, it's relative DM, endo, relative DM, cons, relative DM, oral surgery, general surgery, and public health dentistry. Then short clinical subject, we have the oral radiology, dental anatomy, and dental histology. In pure basics, we have the anatomy, microbiology, general path, and biochemistry. Interrelated, we have the physiology, pharmacology, and general medicine. And general studies, you know, I have mentioned in my videos that what all things, some 7 to 8 topics are there that you have to cover in the general studies. So now first we divide the subject. We should know what are the most important subject and what are the important subject. Okay, the questions are definitely going to come from all these subjects. Then second, we'll divide the days. We have somewhere around, if you are watching video, we are around today 90-95 days, but 10 days will minus and we have 80 days. Okay, of these 80 days we'll divide in 3 parts. That is the 50 days for the long clinical subjects, 10 days for this 2 category of subjects, and 20 days for your revision. I always say make your base preparation, make your concept preparation. It is like that. If you have the proper concept, you can do the n number of MCQ from those concepts. Okay, so this 10 days will be your base, that is your concept preparation, and 20 is revision. Revision is utmost important. If revision is not done, this thing will be of no use. So let's come to these 50 things. You have to divide this 10 subjects in 50 days. So you will have the 5 days for each of this subject. So what you have to do in these 5 days? For example, let's take the simple example of the oral pathology and oral medicine. You know, in oral pathology there are around 12 to 14 topics. You divide this 14 topics, okay, in 4 parts. So you will have the for one day you will have the 3 topics. Okay, fine. So 50 days we have the 10 subject. So 5 days for per subject, and you divide the topics. Like for example, oral pathology for 4 to 5 topics we have 1 day. Okay, then you try to complete those 5 topics at least in 4 days. So 1 day you will have the buffer in which you can do the confusing concepts you can revise, or tough thing you can revise. Okay, so 5 days for each subject. Divide your topic wisely. Today you open your Pulse or Gauri Shankar and divide it accordingly. Fine. So in this 50 days you have to do the long clinical subject. Then for these 10 days you have these 2 categories. Okay, for short clinical subject you can assure that you can complete radiology, DA and DH within just 3 days. Then for anatomy you can give the 2 days, micro you can give the 2 days, and for path and biochem you can give the 1 days. One more extra day you have, you can use anywhere you can want. Then this interrelated subject, there's a physiology, pharmacology and medicine. You have to do the everyday that I will show you in timetable. Okay, so every day at least you have to study 6 to 7 hours. I tell my NEET and AIM student to study for 12 to 14 hours. They have the ample of time, but most of you are practitioners. You are doing practice from 3, 5, 10 years. So you can take out at least 6 to 7 hours in a day, in your afternoon time, in your morning time, or in your late evening time when the patient flow is a little bit less. So 6 to 7 hours in a day you have to study. In this 1 hour you have to study the synopsis and notes. Synopsis from any book you can study, and the notes which I will send you via voice message, via videos, images, etc. So that 1 hour every day you have to study. Okay, and from that synopsis you have to do the MCQs. If you do the directly MCQ, it is of no use. First have the synopsis and notes and then read the MCQs. MCQ करने का भी एक पैटर्न होता है. For example, if you are reading MCQ, if you are knowing correct answer, go for the correction, or little bit if you are knowing, answer it. But if you don't have any idea of that question, leave it. So while doing the MCQ, there should be 2 options: knowing, attempt it; not knowing, leave it. Then what you have to do of this leaving MCQ? Then 1 hour every day you have to give the doubts of whichever MCQ you have gone wrong. You have to go back to the explanation and you have to study in detail. That 1 hour you have to give you. Okay. Now the revision. What is the importance of revision in your preparation? Why you have to do the revision every day? Because तुम लोग आज जो पढ़ रहे हो, that exam you will give after the 90 days. So whatever you are studying will be go in your short-term memory, and you have to convert that short-term into the long-term memory. So for that every day revision is required. Okay, like we do the recapitulation while doing the biomechanical preparation, in the same way you have to recapitulate whatever you have studies. Then comes the 1 hour for the journal studies. You can give 1 hour for general studies. You can read whatever topics you like from them. I will tell whichever the important topics are there in my coming of lectures. And 1 hour will be interrelated subject. Interrelated means physiology, pharmacology and general medicine. Here do only MCQs. Okay, because that are not that much important. They are asking question but not many questions. So for example, you are taking the GIT of physiology, complete the relative pharmacology and relative general medicine. In this manner you have to do the interrelated subject. So in this way you have to divide your time in 6 to 7 hours. Okay, it can be 1 hour, 2 hour here and there, but you have to divide in this way. So friend, this was the blueprint for your subjects, days and the timetable revision. I am not saying follow the same. You can do little bit manipulation as per your convenience, but blueprint has to be there. Okay friends, so see you all in the lecture series, and please keep on reading. Any doubt, you have my number, you have my mail ID, you can contact me. All the best.